Hello and welcome to another edition of the Ask Dr. Pickel show, where we try to find answers and help people who have chronic conditions, chronic health issues. So, all right, well, if you don't know me, I'm Dr. Jason Pickel, and I practice functional medicine, and I'm a board certified chiropractic neurologist. And so today, our topic for today, and it's just kind of something short I wanted to put together for you guys before the 4th of July. But it's diagnosis versus cause. And what does all this mean? And we're going to get into the details of this, because I think it's pretty important that you understand this, because your doctor can give you a diagnosis, but what does that really mean? What does that entail? I mean, we kind of think we know, but really what's it all about? And how does that fit you into the system? Let's put it that way. Okay, so the first thing when we talk about diagnosis, in fact, let's start with that. When we talk about diagnosis, you go into your doctor, you have a set of symptoms. Set of symptoms or a set of signs. Signs meaning like you could have a rash on your hand, or a swollen toe. So signs could also be even findings on your blood test or anything like that. And symptoms could also be those things plus pain or things too. So you go into the doctor and he says, okay, hey, you've got these symptoms, you've got these signs. This matches, if I open my textbook, this matches this condition. Let's say they diagnose you with a thyroid condition, hypothyroidism. Let's say they diagnose you with eczema. Let's say that, again, the wealth of diagnoses is large. If you look actually in the book of coding under ICD-9 or ICD-10 codes at this point, there's just thousands of different diagnoses. So, it's just, but the thing we've got to do is say, well, what is a diagnosis? A diagnosis is a label. Now, it's important to find out what is going on with a person, and you can put a label on someone and say, hey, this is what your diagnosis is. And if in the way the system is set up today in conventional medicine, you have to have a diagnosis first. And then you can say, okay, you can open the book and say, okay, under this diagnosis, what are the 3 different medications to prescribe for this? Or what is the surgery that goes along with this diagnosis, or therapy that goes along with this diagnosis? So this is again, as part of this system. And then that works well with the way the insurance companies are set up and everything like that. In fact, all these diagnosis codes are actually owned by the American Medical Association and used by insurance companies. So again, there's this whole system that's in place, and that's okay. It's okay, but at the same time, does diagnosis tell you the cause? If you say I have hypothyroidism, or if you say I have eczema, does that tell you what caused the problem? No, it doesn't. It's a label. It's like if I put a label on your forehead, this is what you have, and I write it in marker, and you walk around through your doctor's office, and that label is on you now. It's in your file, it's in everything. You have that label. But what is the cause? And that's what we're going to get to is what is underlying a lot of this. And so we're going to kind of take the diagnosis thing and set it off to the side here, because it's important. If a friend comes and asks you, what's wrong with you? What did you find out when you went to the doctor? You can say, hey, I've got this. Here's my label. Here's my diagnosis. And that's okay, because it at least gives something to tell our family and friends that we have this or we have that, which is important, because then they can say, oh, you have that. No wonder. So, great and wonderful. But again, it still doesn't help you always get better. Now, sometimes you can get a diagnosis. The doctor gives you something. You get better. You're good. Everything's good. That's a lot of people. But the people that we see, the people who have chronic health problems, autoimmune conditions, tougher issues, you can put that diagnosis on them, that label, but they continue down the road of they've gone through the whole list. When the doctor opens the book and systemic lupus is the diagnosis, and here's the different medications, and the patient's like, I've tried all those, none of them worked for me, or they made me feel worse. Now what do you do? Because you now don't fit into the system. So, and you've tried it all. So that again is what we have to talk about, and that's where most of our patients fit into. So when we talk about cause, it's important. And in fact, let's take a step back. Let's say that you go to a concert, like a classical music concert, and they're playing music, of course. And you've got your string section, you've got your brass, your woodwinds, you've got all these sections. They're playing in harmony. Everything's perfect. It's all just coordinated. I mean, and that can make very beautiful music, especially when it's so coordinated and it just seems perfect. Now, let's say they said, hey, Jason, you out there in the crowd, Jason, come down here. That's me, Jason. Come down from the crowd, come into the music section here. We're going to give you an instrument to play along with us. Little did they know that I have no musical talent. So I start playing and it messes things up. That coordination really goes off. Everybody's wanting to leave at this point. So it's getting pretty bad. What happened here? This is a disruption. This is a problem. This is something that affected the normal coordination. So the reason why I'm telling you this story is because this is the way we've got to kind of look at the human body. In the human body, there's this thing called homeostasis. And you may have heard this word, you may have not. If you've been in some science courses, they always use this word homeostasis. And what does it really mean? So just think of it this way. Homeostasis is the way the environment in your body is supposed to be when everything's in coordination. When that music is just playing good and everything is smooth and I'm feeling good, this homeostasis. And so we want this coordination because in our body, there is a constant push of stressful things in our body that we actually need. I mean, there's bacteria that live inside of us. There's bad things that live inside of us, but our body keeps them under control, and we need them actually to survive. So, and then our immune system's on the other end pushing back the other way. So, but there's a balance, and that balance needs to be really smooth and perfect. Now, again, if we start to lose homeostasis, we get, again, like when I start playing a musical instrument, we start to get a problem, and that opens the door. So when we lose homeostasis, what happens is we start to get symptoms. If you think about homeostasis and the way our body deals with things, think about, if I take my temperature, it should stay pretty much the same all the time at probably about 98.6. My heart beats, I don't think about it. My lungs are breathing in and out air all day long. I don't think about it. All these things are coordinated and happening in my body behind the scenes that I don't have to think about. So, which is great if it's working correctly. If it's not working correctly, not good. Again, I'll get symptoms. So those symptoms are like an alarm system. It's like, if there's a fire in my house, it sets off the sprinkler system. Not that I have one, and in the house, but again, it would set off, or it would set off the smoke alarm. We'll say that the smoke alarm is going to go off. I do have one of those. The smoke alarm goes off. It makes the noise. Now I can say, you know what? That smoke alarm is driving me nuts. I'm going to go take the battery out. Yeah, there we go. But that didn't help. There's a fire still in my house. So the thing is when we just deal with the symptoms, the smoke alarm is a symptom. It's because there's the fire is the cause. So again, if I just take the battery out or break the smoke alarm to get rid of that horrible noise, or if I just take something for that headache, did that really help the cause of my problem? So, and especially if it's recurrent, if it's like, hey, the smoke alarms keep going off. I'm taking batteries out of this one, that one, that one. There's still some there, but they keep going off. yeah, we've got something, there's a fire still burning in the house there and it hasn't gone out and we haven't dealt with the fire. So we've got to keep that perspective when we look at our health. And we've got to look more towards the cause. And again, this is the way we look at things from our standpoint. So the thing that we're looking for is what's called health. We want to be healthy. What is health? I mean, there's different definitions of health, but is it the absence of disease? Well, maybe kinda, but it's more this homeostasis, because disease factors can affect us, but can our body bounce back? Can our body get through it quickly? Can our body, maintain again? Once they figure out that I was the problem playing that instrument, they took me out of there. They said, "Hey, kick this guy out of here quick. He's ruining everything." Then they can go back to homeostasis. They can go back to health again. Now you have a healthy concert. That's what we want in our body. So if you go in and the doctor gives you something and you feel better and everything goes away for good and you're like, "Hey, I never had that problem again," great. That worked. Somehow the cause was dealt with. But if you go in and you took multiple things, you've tried multiple times, nothing's working, yeah, something else is causing the problem. And that's, again, where we have to look at this. So now the thing is when we get to cause, there's really certain categories of cause that we can look at, and let's go over those, because I think this is kind of interesting and important. So what's the first thing that could affect us? Environmental. Things in our environment. Things outside of us that can come in and affect us. And those things can be heavy metals, toxic metals, because not all metals are heavy metals, toxic metals, xenobiotics. So xenobiotics, I know it's a weird word. It almost sounds like some alien type thing. Xenobiotics, these would be environmental toxins, things in our environment around us, usually chemicals, and or what we would call even organic chemicals. These would be more like herbicides, pesticides, organophosphates, organochlorines. Those are more in that Roundup category. If you spray Roundup in your yard or on your garden, that's a problem. In fact, it's been there's a lot going on with that here recently. With it's a carcinogen, it's a cancer causer. So plus it does a lot of other negative things. But I'm not going to just get into that. There's so many of these possibilities, these chemicals that we're surrounded with on a daily basis. Plastics. I mean, anytime you heat up something in the microwave in something plastic, the PCBs, polychlorinated bisphenols, will get into your food. Now, if your body's a good detoxifier genetically, it's probably not a problem for you. But if you have a health issue, if you have a chronic condition, an autoimmune condition, these things can start to affect you. Another thing in the environmental side, that's going to be radiation. And when we think of radiation, we don't really, it's something you don't see. How can it affect me? I mean, a lot of these things we can't see, but radiation is just kind of that weird thing. Doesn't radiation just come off of nuclear power plants or atomic bombs? No, radiation comes off multiple things in our lives. In fact, the computer screen that I'm looking at right now is emitting ionizing radiation right now. Not always good, especially if you have a thyroid problem. But there's all kinds of sources. If you go get multiple x-rays at your doctor, you can get radiation. So, your cell phone emits radiation. So again, if you go through an airport security, you get radiation. So there's all these sources of radiation, but again, how does your body deal with it? Again, it's another cause. And in fact, talking about cell phones, that's another thing. It's EMFs, electromagnetic frequencies, which, it's like, this is weird stuff. Electromagnetic, this is what comes off of computers, cell phones, all these different electrical things that are around us. The alarm clock that sits by your bed at night emits, especially if it plugs in, that emits tons of EMFs. So again, these electromagnetic frequencies also play a big factor, and that's actually a form of radiation again. Do we want our bodies, our brain being irradiated on a daily basis, no, it's not good. And geopathic stress, this one also kind of is like, what, geopathic stress? So let's say your house was built on an underground river that you didn't know about. That's geopathic stress. There actually, the best way to do this, I don't want to get an explanation, but if you Google geopathic stress, yeah, it's interesting stuff, but it can create problems. There's all these things that it's like, what the heck is that about? And why doesn't it affect everybody? Well, let's put it this way. Many people genetically are really good detoxifiers. Their health is great. Their body can handle stressors. Their body can dump toxins. Not really a problem for them on a lot of things. Most of my patients, most people with chronic health issues, autoimmune conditions, their immune system can't handle much. They're not good detoxifiers. This stuff gets stuck in their system. Health problems. All right, so we got environmental. So next, let's go to biological. So biological, this would be like any of your infective agents, bacteria, which again, bacteria aren't always the major problem. It's about our immune system and its ability to handle bacteria. We're loaded with bacteria, all kinds of things. We've got staph that lives on our skin. We need it. We've got a strep that lives in our throat. We need it. We could name off all kinds of bacteria that live in our body. We need them, but there's a balance. There's homeostasis. They're pushing one way, our body's pushing the other. That actually helps us to maintain health. It keeps us toned. It keeps everything going. So we need these guys. But again, they can become a problem if our immune system's not working properly. Then their populations rise. They start to cause inflammation and symptoms. Same thing with viruses. Of course, there's a lot of information right now going on with viruses, especially like coronavirus and things like that. So, this is another thing we're bombarded by. Can our immune system deal with it? Can it not? Funguses, also there's some fungus that lives in us. Candida type funguses live in almost everybody. But again, if our immune system is working right, their populations rise. Now, there's also funguses that not only live internally in us, but they live externally. If you have black mold in your house, if you have aspergillus in your house, yeah, the spores of those things can get into your system and create problems if your immune system's not working right. So again, it's even looking at that. All right, what's another one? And then one more thing, I said fungus, but I didn't even say parasites. So parasites, you don't hear about those a lot in conventional medicine. It's because they don't have a lot of good tests for looking at them or looking for them. Parasites are so common. In fact, most of us have parasites living in us, and some of them, again, kind of that relationship that we have with them. But there are some that can be more detrimental to our health. And again, I hate to say, if you look at food under the microscope, all kinds of little guys in there. I know that might gross you out, but if we eat these things, our immune system and our gut, the acid in our stomach, should take care of them. They shouldn't create problems unless those areas aren't working properly. Then those parasites can thrive and start to create problems. All right, so that was biological. Let's go next to pharmacological. So pharmacological or pharmaceutical, this would be medications. At many of your medications, make sure you look at your side effect list. A lot of times they'll box that side effect list in there, and it's rarely looked at. Or you can even ask your pharmacist to give you a printout. What are the side effects of this medication? And sometimes it'll say, oh, these are common side effects. These are rare. These are less common. That doesn't really mean a lot, I hate to say. I've seen people get the rare and on a more regular basis. So you can't really always look at those as far as the classifications, but you can look at all the side effects as potentials. But there can be more because there's things that don't always show up in the studies, or things that maybe I hate to say aren't reported. And you can't even think of it that way from taking the medications. But even if you took a past medication, medications leave residues in our system. And those residues, if your body can't get rid of them, yeah, they can create chronic issues. So we can't just say, hey, I stopped the medication, I don't have to worry about it anymore. Maybe you still have residues in your system. Maybe it's a medication that affects the brain. Maybe you have residues of that in the brain or the gut or somewhere else in your body. This can be a problem. Supplements can fall under pharmacological. So there's many supplements that can make you worse. And, from a doctors who practice alternative medicine, supplements can be great things. But if you have a patient with an autoimmune issue, or if you have an autoimmune issue or some chronic health condition where the immune system is skewed one way or the other, if you give a person the wrong supplement, you can make them worse. So just like a drug, they can have its negative effects too. So it's not like supplements don't have potentials, especially herbal supplements. They even more so have potentials for creating issues. So you've got to keep that in mind when you're taking your supplements or trying things, because it might say online, hey, take this if you have this symptom. Well, you could, but everybody's different. How do you know that symptom is related to what you have compared to what the other 10 people who took it or the person who posted that on the internet? So again, kind of looking at that direction. Also, substance abuse agents. So if you abuse substances, drugs, alcohol, things like that, this can of course this is under those pharmacological agents, this can cause problems. Side effects of vaccinations, we see these things occur. Not only the vaccine residues themselves, but also the within the vaccines, there's preservatives, thimerosal, aluminum's the big one now. So again, can these be problems? Yes. And food chemicals. So in our foods, especially as food gets less expensive, such as meaning you buy junk food, it's cheap. If you buy really healthy food, it's expensive. So again, as you look at these foods, you'll see the long lists of all the ingredients in there, kind of scary. But these are these food additives, and these can create problems too. Dyes. There's actually still some like red dye is still legal. It's kind of crazy. And we won't get into all the details of that. Okay, so next we have physical. So what would be physical causes or physical causes to your health problem? These could be traumas, injuries, especially any injury to the head or the brain, like concussions, things like this. Even though like the symptoms kind of went away, it's like I had a concussion, I'm not sensitive to light anymore, I don't have that headache anymore. Is it still affecting you to this day? Is there still something being affected? You had a trauma to your brain. Even skeletal traumas can sometimes leave some things. Traumas to organs or tissues, it's surgeries. Anytime you've had a surgery, this is a trauma to the body. And in fact, anytime you make an incision in the body or cut open something, you have the potential of creating scar tissue, and this can also be a problem too. So again, it's looking at all these possible causes, but definitely scars and surgery we commonly see. And not only surgery, but what did they end up doing in the surgery? Did they take out your gallbladder? Hey, that's a potential for a problem in the future. All right, even though maybe it gave you some relief. And then the last one here, emotional. So emotional, our body, our brain, we're not just this physical robot, and in the past, in fact, probably even 10 years ago, it was thought that somehow the emotional side of the brain and the physical side didn't really connect, and doctors shouldn't think of it that way. If you had an emotional issue, you went to the psychiatrist or psychologist. If you have a physical issue, you go to your regular doctor. So, but the thing is it all connects. And we know this, and we know it, we've known it for a long, long time, and the research is profound. So there's no question as to that, but what can affect you emotionally? Things that are traumatic and that have happened in your life. If you've had some type of trauma in your life, if you've been assaulted, that can really affect your health overall. It can cause problems, not just mental or emotional problems, physical problems. So that needs to be dealt with. Shocks to your system. Did somebody shoot at you? Were you in some bad accident? These types of shocks can create lasting problems too. Deprivations. People have gone through all kinds of stuff, and you'd be amazed on what people go through. It's quite sad what people go through sometimes. And a lot of times they don't talk about it. You don't hear about it. They hold it in or have learned to try to deal with it themselves. But this does have consequences, or it can be a cause to health issues. So getting back. All right. So now we know more about cause. So you can get a diagnosis. A doctor can say you have this, but again, what is causing it? Are some of these issues at hand that we just talked about causing your health problems? Big possibilities. The thing is, though, is finding them. You've got to find the puzzle pieces that are the cause. And a lot of the typical conventional tests, they can find some things, or they can point you in the right direction. But one test usually doesn't do it. The general test for major pathology, you can go get an MRI of the brain. It may show you, do you have a tumor? Do you have a blood vessel that has burst, or some, embolism, or, you can see major pathology, but can you see a heavy metal in a brain cell on an MRI? No. Can you see a chemical in your cells, like herbicides and pesticides on an MRI or any typical test? No, these things are in the cells. They aren't floating in the bloodstream. You can't see these things. Now, you could potentially biopsy something and maybe see some of these things if you look under an electron microscope, but that's not going to happen because you can't biopsy that many cells in your body. So, and the chances of missing it or not finding it are pretty high. So that's why with our testing, we've had to go outside the box. We've had to look in other directions to find things, to find these causative agents, and then not only find them, but to deal with them in a safe way, a way that helps the body to get rid of this stuff properly, and again, in a way that it's not harmful to your body. Because and everybody's so different. So, what one person, 10 people could have the same diagnosis. 10 people could be diagnosed with multiple sclerosis. All of them may have totally different causes. All of them may have a totally different underlying, if we look at their blood work, it may be totally different in each one of them. So again, the diagnosis is the label, it's finding the cause, and it's dealing with it. All right. Sorry to get on my soapbox just a little bit there too, but all right, I think there's a couple of comments there. Thank you, Jeannie, for commenting. And I just want to say I hope everybody has a wonderful 4th of July. Thank you for watching. God bless, and I will see you next time. And also, don't forget to share us on Facebook, YouTube, like us and give us the thumbs up, and share us forward, and also set your reminders so you know when our show comes on. All right, well, I hope everybody has a great day. Talk to you soon.